Welcome to Together for Good, brought to you by Baptist Health Foundation of San Antonio. Together for Good exists to recognize and uplift the many people working together for the good of San Antonio and the surrounding communities. Now here's the host of Together for Good, Cody Knowlton.
Okay, thanks, Katie. Hello, and welcome back, everybody, to Together for Good. This show is being brought to you by Baptist Health Foundation of San Antonio as a part of our mission to honor our Lord and Savior Jesus Christ and our Baptist heritage by encouraging and funding health-related programs at area nonprofits and churches. Through Together for Good, we connect our audience to the great work these organizations do in our community. I'd like to circle back to something I say every week in my intro. This show is brought to you by Baptist Health Foundation of San Antonio. Now, there's another organization in San Antonio that has a very similar name. And sometimes, believe it or not, things can get a little confused. So before we jump into today's conversation, I want to offer some clarity. Baptist Health Foundation of San Antonio, the organization that I lead, is a nonprofit charitable foundation that honors God by distributing grants to nonprofit organizations providing healthcare services. Baptist Health System is a system of hospitals, clinics, and healthcare providers helping people achieve health for life through compassionate service inspired by faith. Our two organizations have some shared history, but operate separately and are both inspired by each other's deep commitment to the people in our community. So today, we'll be talking to Bill Waechter. He is the market CEO for Baptist Health System and a longtime friend of the foundation, as he has been with Baptist Health System for many, many years. With a long and successful tenure at Baptist, Bill has served in multiple leadership roles, including president recently of North Central Baptist Hospital, where he has overseen the Baptist Children's Hospital and Baptist Orthopedic Hospital. His strategic vision and dedication to excellence have played a key role in advancing healthcare services across the system. Before joining Baptist, Bill was a flight paramedic and held leadership positions with San Antonio Air Life, which is an air medical transport service. His background in both emergency care and hospital administration reflects his passion for improving patient outcomes and strengthening healthcare access. So, Bill, it is just an honor and privilege to welcome you to Together for Good, primarily because you just became the new CEO of the Baptist Health System after serving as the president of North Central Baptist for many, many years. So congratulations on that move, and we're glad to get the new guy in studio to talk to us today.
Yeah, well, thanks for having me, Cody. I'm excited about this broadcast and sharing a little bit about what we're doing and the things that you get, the great things you guys do. But it's kind of funny. I started May 2nd, will be 31 years ago with the Baptist Health System. So
Wow.
It has been a while.
Wow.
It's been a great journey.
Well, we're going to talk all about that. So what is the current state of healthcare, Bill, in our nation from your vantage point, and then right here in San Antonio?
Yeah, that's a great question, and I think timely with the things that are going on with our government. A lot of focus on a lot of different things, and it has created some angst, if you will, particularly about particularly in the realm of like government funding and so forth, with Medicaid, Medicare, and so we're watching those things closely and advocating for our patients appropriately as a hospital system. But overall, I would say, healthcare in San Antonio is great. We just opened up a brand new hospital over by SeaWorld. We've actually had that land out there for a number of years with the idea of growing that. But we are when you look at our health system, it's geographically based. We have hospitals all over town taking care of patients in all the different neighborhoods. And that newest hospital over there was a long time coming, but it's a beautiful facility. Now we can start to take care of those patients over in that Westover growing community if you've been out there. And we've actually banked some land up in in Kendall County and Bernie. And so probably here in the next 18 months, 2 years at the most, we'll probably have another hospital out there in Bernie and take care of those patients in Kendall County. That whole county does not have a hospital, which seems hard to believe. It's just such a growing area as well.
Yeah. Well, keep going there, Bill. I mean, tell us more about the Baptist Health System. I mean, how many hospitals, clinics? You've covered Westover and Bernie.
Sure.
But tell us about the rest of them.
Yeah. So again, being very geographically based, we have hospitals all over San Antonio. I'll kind of start downtown, the old Baptist Memorial Hospital. We call it Baptist Medical Center now. It's right there on 111 Dallas Street, out by the airport, by San Antonio Airport. We have Northeast Baptist, which is kind of funny when I think back. I actually got about 20 stitches across my chin somewhere back around 1971 or so when it opened up. It was pretty new at the time. North Central Baptist in the Stone Oak community. Mission Trail down on Brook City Base. St. Luke's Baptist Hospital and the Medical Center And then, of course, as mentioned before, that new Westover Hospital. We have a hospital called Resolute Baptist up in New Braunfels. And then scattered amongst these larger big box hospitals, we have what we call the neighborhood hospitals. We have 9 of those just scattered all throughout San Antonio that are there. It's an emergency department with some inpatient capability. Not as high acuity. You're not going to see the sickest of the sick patients in those facilities, but they are very conveniently located. Hence the reason we call it the neighborhood hospitals. We've got 18 locations where we've got physical therapy available here in San Antonio. Just about everywhere. It's called Health Link. And you may know the main building, the main office is right there on Bitters and 281, but we literally have them all over San Antonio and the surrounding area. And then about another 16 imaging centers scattered throughout San Antonio for those, everything from high-end PET CTs, MRIs, and different imaging modalities. And then we've got healthy women's centers, about 5 of those throughout the area that help people who there's free access to pregnancy testing and all the services provided there. So we're all over this area, and have been for a number of years, and we look to continue to grow. We'll have another neighborhood hospital in the next year or so as well.
That's great. Talking more about the healthcare of San Antonio, since you've been in healthcare for 30 years, and we always hear obesity, diabetes, all those things are such prevalent problems here. And I know each of your hospitals specialize in different things, stroke and all that. What do you see as kind of the overarching healthcare need here in San Antonio? I know y'all do a lot of treatment in the heart area, but
sure.
What would you say to that question about kind of the pulse and health of our community?
Yeah, like what do we need?
Yeah.
Well, once they're at the hospital, you have to remember, things have not gone well. So when I think about needs, I look at the continued need to have access to a good primary care physician, somebody that you can go and talk about your medical problems, run labs and so forth, and really kind of quarterback your health care. Whether if you're having, cardiac problems, getting you in with a good cardiologist to manage those things, but having that physician who's looking out for you, that you're meeting on a regular basis, and always I laugh about it, but my dad would always, he'd try to eat right and all that kind of stuff right before he went to his primary care physician. And I would argue just be normal, because you want your doctor, to really understand what you're doing on a daily basis so they can give you good advice. And hopefully, eliminate the need, to have a hospital. And whether it's the diet or treating those issues that you have to keep you out of the hospital. And same thing with kiddos. Kiddos need to have a good primary care, a pediatrician to make sure they're, getting the good advice and steering them the right path and, to start a good trajectory in their life and have a healthy life.
Can you drill down to some of the facilities that are specializing in certain services that y'all are proud of?
Absolutely. We have gone through kind of a hub and spoke model over the years. Now there's basic, you have basic services at all the hospitals, but we have specialized in certain areas like at St. Luke's it was San Antonio's first comprehensive stroke center. So this, where the sickest type of patients with strokes can go to have all the most advanced care possible, coils and drip TPA, and it's incredible. San Antonio just didn't have an organized approach to taking care of stroke patients, and it's not been that many years, like in the last 16, 17 years or so, when we finally started this comprehensive stroke system. And now you're having patients that are having stroke and stroke-like symptoms. They're able to be diagnosed very rapidly, and then given that intervention in a timely manner, so that patients can have, sometimes a full recovery from a stroke, which would not have been possible years ago. The same thing with cardiac services. We have our two of our centers we are calling our complex heart centers at BMC downtown Baptist, and then at North Central Baptist. Now, Northeast has a great program out there, particularly along the lines of electrophysiology. Patients, you've probably heard of something called AFib, and you'll see those patients treated out at Northeast. We've got some great physicians out there, and that's where a lot of that work is done here in the city. So again, kind of hub and spoking. We do have at North Central Baptist and at St. Luke's, we've got level 4 neonatal intensive care units. And this is where you take care of the smallest of the small babies. I mean, sometimes these babies are born weeks and weeks, premature, maybe 23 weeks gestation. And it takes an intensive care intensive team to take care of these patients with all kinds of needs, just so that they can have a great outcome. And that care continues with our developmental clinics when they've graduated from the NICU. So those are some big service lines we have.
Okay. Well, as we mentioned, you just took over as CEO of the system after a long tenure as a president of North Central Baptist. What is your vision for the system going forward?
Yeah. Part of it's, I'll kind of answer that in a funny way. It's like, what do we want to be when we grow up? In fact, we just had this conversation. We, down at First Baptist, we had an awesome meeting this Friday ago, and we have all of our leaders come in, and we talked a lot about that. For me, nothing is more important than quality and patient safety. Mm-hmm. And we are in a complex business. I mean, taking care of patients is people come in with all types of different things, and we want to make sure they have good outcomes. And part of that is dedicating ourselves to high reliability system and having great safety measures and check and error proofing and making sure that everything is done in exactly the right way. And then focusing on disease processes. It used to be that it was just understood that when patients came to the hospital with central lines and so forth, this is a few years ago, where 30% of patients got an infection from that. That was just sort of an understood thing. Well, we have changed that mentality, and we look at those hospital-acquired infections with a great deal of scrutiny, and have gone through and vastly, virtually eliminated some of those things because of practices that we put in place, and this desire for, this high reliability journey that we're on. It doesn't stop. This is something we'll continue, but to have that, good, safe environment is what we want to do. I love this organization called Leapfrog. They kind of look at hospitals and they compare them in certain things, and a few of our hospitals have been an A rating for a long time. In fact, North Central, as I understand this last reporting cycle, is only among 96 hospitals in the United States that participate that has been an A for since like 2018. And only 96 hospitals. Wow. And it's kind of like school. It's A, B, C, D, or an F. You don't want to be an F. But anyway, my vision is looking at those outside, organizations look at us that look at our quality. I want to be top notch and deliver the best patient care we possibly can. And then a part of it is being, a good health system and bringing access to the latest technology, whether it's the brand new DV5 robot that they can do surgery on in the operating room. Or it's a new modality to look at better treatment of lung cancer. Mm-hmm. So making sure we've got those funds and the capital required to bring in this very expensive technology, but life-changing technology we can bring to patients. To continue to be, pushing that envelope to where we are, out there in front and able to deliver the best patient care possible.
Yeah. Bill, how many of your patients come from outside San Antonio proper? I mean, obviously San Antonio is Bexar County, big county, but how many come from kind of the rural areas around our city?
Well, it's when we kind of look at our numbers, it's sort of surprising. We have patients that even come from out of state, Cody. Mm-hmm. Sometimes from distances and even out of the country. Patients will take patients that have been down in Mexico, usually citizens who've been down there and find themselves ill. But about 32% of all of our patients come from outside of Bexar County.
Wow.
Yeah, kind of a surprising number. But we've got those counties contiguous to Bexar County, probably most of those patients coming from there. But, when you're going out to Del Rio and Eagle Pass, Carrizo Springs, all the way out to Junction and, Sonora, we'll see those patients end up here usually it's for specialized care that they can't get in their own communities.
Yeah. What options exist for people who are uninsured or underinsured but still need care?
There's a lot of there are options for patients. First off, hospitals are obligated to take care of anybody. If somebody shows up to the emergency department, we are going to take care of them. There's no billfold biopsies. We're not looking at, whether they have insurance or not. We're going to take care of that emergency condition. That's very, very important. Now, we are an acute, healthcare system. We do like people to look at the community resources. Again, it kind of goes back to one of your first statements about what do we need. We need that good primary care. And, patients, whether you have insurance or not, need to be taken care of their bodies and seeking care that's out there so that they can avoid that. That's probably the best thing. But there are other resources. We'll help people apply for things like CareLink, which is administered through our county hospital, the university health system. We also have other organizations that work with our patients from a mental health standpoint, reduce prescription drug rates. So there's a lot of programs that we'll go out there through our case managers to make sure that people can get that access.
In the past 5 years, we've heard a lot about the nursing shortage. In fact, I've heard that probably since I got this job at the foundation years ago. Has it improved any? I remember hearing that staff, overall is an issue, turnover, et cetera, but focusing more on nurses, are we making progress in the nursing area?
I would say we are. I'll tell you, the years through COVID, particularly the first, couple, maybe 2 or 3 years after COVID hit, were some incredibly difficult times when it came to healthcare workers. It's easy to kind of forget how bad that was. But the first wave of patients, if you will, they're very, very sick, and we ended up with some programs where nurses were going to hotspots throughout the United States, and it caused a whole bit of traveling that nurses were able to do and go to different areas, which was pretty neat. But I would say nursing is kind of getting back to normal when it comes to the travel piece of it, at least, and that has stabilized. And then there's a lot of really good schools out there. In fact, a young lady that my son is dating just took her NCLEX and graduated in the last couple of weeks, and so she's going to be a nurse. But we have some great schools, as you know, the Baptist School of Health Professions. We have about 500 students in that organization. And a lot of them are nursing. In fact, the majority of them are nursing students, and it's a great career that you can grow into. So it's better. You're seeing a lot more specialization. People kind of know what they want to get into, whether that's labor and delivery or in the emergency department. And so forth, or even in other areas like quality, patient safety, looking at analytics. So there's a lot of things that nurses are getting into that aren't necessarily just for the hospital or, things like that. But it is attracting a lot. I think arguably, though, if you look at the numbers nationally, there is an overall shortage. So what we're focusing on, Baptist, is we want to be a place where those nurses want to come. Years ago, you may remember Charlie Martin. He had a statement one day. He said, "There's no shortage of nurses. There just may be a shortage of nurses that want to work for you." So what can you do to be that preferred employer where it's a great place, from a career standpoint, the work environment, the support that they get. And so that's what we want to be. And so it's, I'd say we're in good, we have become in good shape when it comes to nurses, and focusing on that retention because we want to be the best employer. And that's really helped out.
Yeah. Well, retention is the key.
It is.
Yeah, for sure. Can you tell our listeners a little bit about the faith-based roots of the health system? I mean, this is obviously a shared story for both of us. So tell our listeners the faith component.
Yeah, the hospital governing board, back before it was affiliated with the Baptist, they came together in about March of 1948. They approached the church, the Southern Baptist Convention, and that is when they formed the Baptist Memorial Health System. And so 1948 is when that started. Wow. Now, as you know, Baptist has gone through a couple of ownership changes over the years. Vanguard back in 2003, which I think is where our shared history starts. And we have kept that faith-based mission. It's a very important part of that. In fact, when Vanguard purchased it, one of the articles that we started was the Mission and Ministries Executive. And so, having been there before the change in 2003, I've gotten to see both sides when we were, actually owned by the Baptist General Convention, to Vanguard and now Tenet. And I think our faith-based mission is as strong as ever.
Wow, that's good.
And we've kept that education going. We've got an incredible, team of pastors and clergy in the hospitals, and it's foundational about what we do. We want to make sure that we are there with that and supporting that faith-based mission that we have.
Well, you touched a little bit on this about the faith-based mission. How do you intentionally go carry that forward today? I know you've got chaplains and chapels,
right?
But
and with
tell us more there.
With that education piece too, we are a place where chaplains can come and do their clinicals, so they can continue that mission, which is an important piece. But really, making sure they're part of every bit of what we do, whether it's, taking, we have a chaplain, for example, at North Central who is dedicated to the neonatal intensive care unit. And, that's a tough world. You're a aspiring family, and all of a sudden you have a baby who, is delivered at 23 weeks, and you're going to spend weeks and months possibly up there. Sometimes in very critical situations, it really stretches you and challenges you. And having that person there to be there and whatever that might be, just talking, leading in prayers, or praying for. Those are such important and so well received by our patients and so needed by our patients. So having those type of things, being an organization that we can have a prayer before a meeting. Not everybody does that. It's like, I think sometimes you have a visitor come in, they sort of, they're surprised by it. And it's just, I wouldn't know any different, from a workplace. I've been here my entire adult career, but it's nice to be able to do that and reflect. Joe Perez, who's our Chief Ministries Officer, he is so thoughtful in the messages he brings. I really appreciate that. And he's able to just tie into the work that we do and how we're impacting people and remembering, that we're taking care of God's children. And that is an important, and a huge responsibility. And we should take it as such. And it's nice to have that reminder all the time.
Absolutely. Is it ever challenging, Bill, to remain dedicated to a faith-based values all throughout kind of a busy, modern, for-profit healthcare system?
Cody, I don't know what it would even be without it. I don't find it to be a challenge at all. In fact, I think the challenge is, if there is to how do we inject that more into what we do every day? Our staff and team members and physicians, they come from all walks of life, and all faiths, and some without. And that too is a mission, to bring that to our staff and our team members. So I don't find it difficult at all. It really, the only difficulty is just what can we do more? Yeah.
Bill, what would be, I guess, the thing you would like San Antonio and the surrounding communities to know about Baptist Health System that maybe they don't know?
Well, I think that some of the things I like them to know is that, we are right here in your community. And a lot of times I think people through, some really good marketing and advertising, they think they need to go to other cities for care. But San Antonio has developed a great healthcare community. And you can find the same level of care right here in San Antonio, right here in the Baptist Health System that you could go to if you needed to travel to another city. And I think that's important because, when patients think they have to go, and I had a family member who did this. They went to Houston because they thought they needed that. Well, they could have gotten the same care here and not had so much of the disruption and the inconvenience of, finding a hotel or, where to stay and trying to be supportive of that family member while they're, several hundred miles away. So that care is right here. It's available right here at home.
Okay, Bill, tying off of that last question, if somebody does choose to stay here in San Antonio, but perhaps they're even in the ER and needing to decide, where do I go next? How do y'all help folks navigate that?
Yeah, that's a great question, Cody, because, the emergency department is really, they are here for the emergency aspect of it. And, sometimes you may have chronic problems, whether it's pain or, whatever it happens to be, where you need to go to the emergency department. But it's like, what do you do after that? And, I'll use a great example. A friend of ours a while back, kind of was able to demonstrate this, not in a great way. It was a patient who came in with some severe back pain. And, the patient was treated and, imaging and so forth done in the emergency department to kind of figure out what was going on. Well, they really needed to they need to follow up with a specialist. But they really weren't sure who. So we actually started, and we've done this in some other areas, and I'll give one other example, but we started a navigation program. So we have a nurse navigator who, based on your condition, they may give you a call. You may opt to utilize them or not. You're not forced to, but they know the landscape. They know the services that are available. So, for example, this patient who came in with back pain, they were able to kind of isolate what was going on through working with the physicians to understand what the needs were going to be, whether it was rehabilitation or did they need to go directly to a spine surgeon. So they were able to follow up directly with that patient and in some cases even get them an appointment with a physician who's available to be seen in a timely manner. Because that's a lot of times, sometimes, it's finding a physician, but actually finding one in the relatively short period of time, not 2 months from now. So that's important. And for years, we've had what we call the Great Expectations Program. And it was originated for brand new parents. And you may go back in your mind when you were a brand new parent, you just found out you're going to have a baby, like, what do we do with that? But we have this person, Chris Baxter, actually is her name. She meets with these new families and she'll do tours of the hospital. She can show them where they're going to do classes and where they're going to deliver, where to go and that kind of stuff. But then more importantly, like asking those questions or helping guide you through the process, like, do you have a pediatrician? You're going to need to have one of those. And then in some cases, whether it may be a foster parent situation or complicated deliveries where maybe something's wrong, and she actually helps those patients get together with the physicians. They have a physician conference all of the different physicians and that are going to be needed and services needed to have a safe delivery and then the care after that. She puts all those people together so they can have a great outcome. So they really almost handhold these patients through these processes because it's complicated. If you don't know that world or you're kind of thrust into it, especially a new pregnancy and you're, you thought you had another couple of months to kind of plan things, and here you are with a brand new baby. Chris, that patient navigator can help you walk through those situations. It's an amazing program, and we get such good feedback from it.
Well, Bill, thank you for coming in today. I feel like we could have talked a lot longer, but our time is up. And so just congratulations on your new role in the system. We're grateful for your hard work and all that you're doing for Baptist Health System. So let me offer a word of prayer for you, my friend, and we will depart. Lord, thank you for this day. Thank you for Baptist Health System, for Bill Waechter, for his commitment to healthcare, his leadership that has been evident for so many years in the hospital setting, and now more at the leadership and system-wide side of the equation. So we just lift him up as he embarks on his new role as the market CEO. And so we just pray for him as he leads and guides. And we love you in Jesus' name. Amen.
Amen.
Listeners, we're grateful for y'all and grateful you've joined us today. You can catch our episodes anywhere you get your podcast or by visiting Baptist Health Foundation of San Antonio's website, bhfsa.org/Together for Good. We're going to be back next week with another great conversation about health matters and the work of our nonprofits in this area. God bless and take care.
Thank you for tuning in today for Together for Good. We hope you've been encouraged, uplifted, and inspired. Until our next time together, may the Lord bless and keep you. And in all things, to God be the glory.